everybody. Happy Tuesday.
Happy Twin Tuesday.
Whoop, whoop. Dr. Madeline's back in the house, and we're in our very special place, my garage.
Her garage / laundry room / workout studio.
Oh yeah. So we're going to be talking about some fitness stuff today, or some things that actually change and can happen with your body when you're pregnant and postpartum. But first, who are we?
I'm Dr. Madeline.
And I'm Dr. Johanna. We're your awesome chiropractors at
Atlas Chiropractic Center, which
is in sunny St. Petersburg, Florida.
Yeah, we're family wellness, but our jam is pregnant and postpartum wellness, which is what we are talking about today.
Yeah, absolutely. So what are we going to talk about today? Because I know we've had it come up a couple of times in practice over the past couple of weeks, and we like to bring things that are important that you guys are talking about and curious and interested in. So we're just putting it right back out there to you.
Yeah, well, before we get to that, if you're hopping on, say hey, drop some emojis down. If you're catching the replay later, say replay down below so we make sure we don't miss you. And if you have any questions, we appreciate all of y'all who tune in and share so other women and families can get this information. Yeah. So yeah, we're talking about pretty much like diastasis recti today, and like sit-ups through pregnancy, and that can transition through postpartum.
Absolutely.
Because I would say we've gotten this question quite frequently in like the last couple of weeks by multiple people who are, I would say, more new, like more in their first trimester.
Yeah.
Right? Yeah. Yep. They're trying to maybe sit up and get out of bed. Maybe they're working out and they're still doing crunches, that type of motion, and they're having issues, and they're coming to us and they're like, what is going on? Like, I don't understand.
So, well, what is diastasis recti? Because you may have heard it called that, you may have called it shortened for DR, you may have never heard it before.
Right, yeah. So diastasis recti abdominis is something that is going to happen at some point during your pregnancy. It's going to happen different times for different mamas, because all of our bodies are built differently, right?
Sure.
Yep. But you have your rectus abdominis muscle that's running pretty much kind of from this area, and it's going to come all the way down, kind of towards that like pubic bone. And that's like your six-pack abs. So everybody knows this one. It's that muscle that gives you the six-pack, right?
Yeah.
So what a lot of people don't know, I guess, about this muscle, though, is that it's kind of like two parts, and it runs here. And there's this thin sheath of connective tissue that attaches it in the middle. Wow, cool, right? You should look up. We'll have to like post some pictures later. But anyhow, so it runs this way. There's a connective sheath in the middle. So when we're pregnant and our body is growing, we're gonna eventually come out, right, to grow and make room for baby, because baby's gonna get bigger.
Yep.
So that, since it's not connected and there's that connective tissue in there, it allows our belly to open up more to make more room for baby to prep for birth, which is pretty cool. Like, our bodies are innately smart to do this stuff, which is awesome.
So this kind of thing, so diastasis recti is common, it's normal, I put normal in quotation marks because it's just common that it happens as your body changes with pregnancy, postpartum, and there is a little like asterisk to that because other people that are not pregnant can also have it as well, but we're not getting into that today.
Yeah.
So it's totally cool that it happens. The body's designed to do what it needs to do to make room for a baby and to come back to
Right. So it happens through pregnancy for sure. Other people can have it. I think those are some key points, even if you're a man or you're not pregnant or you haven't been pregnant. I would like to also say, like, it's quote unquote normal through a certain phase of pregnancy, but postpartum, everybody's degree of it's going to be different, and sometimes more rehab is going to be taken for postpartum for certain people than others. But that's why we always talk about coming in and talk to us about some movements that breathwork that we can do, and also consulting with a pelvic floor physical therapist who specializes in women's health to help with that rehab process.
Because not every provider, so OB, midwife, chiropractor, PT, not every provider actually checks for this within your postpartum check. And it could be something that is easily like missed, and you don't even know what's going on, and you try to get back into the gym, and you're like, I'm gonna crunch, and I'm gonna sit up, and I'm gonna plank, and then you have something that happens called
Coning or tenting.
Coning or tenting, so two different words with that, and what exactly is that?
So essentially, if you are in your house right now and you try to like do a sit up, like, you're gonna feel that pressure in your belly. So anything that's building what we call that intra-abdominal pressure, which we build all the time, whether you realize it or not, especially when we're like lifting up our kids or picking up things, those type of things. But when that pressure increases and you're trying to do, let's say, that crunch or that sit up, that's going to push that pressure somewhere, and now we have an opening in that area. So you can see it. Sometimes it's hard to see on yourself, I'll give you that. So knowing a provider or somebody who can help check this for you is really important. But when you're doing that motion, you're gonna see kind of like this tent essentially, or kind of could be a little bit more like Conan and domine are some other words, and they're a little bit different here and there, but essentially you're going to see this kind of peak out with the extra pressure.
Yeah.
So when we see that, that's just a good sign that that movement and that way is not great for us at this moment. That doesn't mean you can't ever add it back.
Right.
That doesn't, like any of those things, you can at some point, but right at that time, it's not the best movement for you. And there's so many different ways to scale or give you different options to still get an effective workout or working on what you're trying to do without having to do, like, say, a crunch or a sit-up. But it's not just crunches and sit-ups either.
No, I mean, it's really any type of motion that can be happening in the gym. I mean, it can happen with pull-ups, it can happen with squats, bench press. I mean, when I was working out and I was pregnant, I constantly made sure that either you were checking me, or when I usually work out with my husband during that time, that he was checking to make sure it wasn't happening. And if it was, I was shifting and changing that exercise. And it is important to note, just like diastasis recti, coning, doming, that kind of stuff can also happen and any type of person that is being physically active or doing any types of exercise. So even though, you know, our jam is pregnant mom and postpartum moms, this information is important for your spouse or your workout partner, because you may just, you know, now that you heard this, check them and see if that's going on, because that is not the best movement for them, because it's going to cause dysfunction. You're going to have a higher probability to hurt yourself, injure yourself, which is the most important thing, because like Dr. Mountain said, there are so many alternatives out there to get you the desired result that you're looking for, and to make sure that you're not harming your body during that process.
100%. Yeah. So I would say, like, let's just say, since we're talking like sit-ups, and that's what I got y'all with the hook, let's just say you're newly pregnant or you're going through your pregnancy and you are now aware of like coning or tenting, and let's just say you notice it's just harder to do a sit-up, so you're in your mind, you're like, okay, at this point I kind of want to change the movement, or you notice that coning or tenting, so you're like, okay, well, I didn't even know about this, so let's change the movement and do something that can support me in a different way without adding to that issue right there. I would say like a dead bug is a really good one, but you still have to check for the coning or tenting in this one. If you're on your back, and again, if you want information on how to do these, just comment that down below or message us this, because I have videos on this.
Yeah.
But if you're doing a dead bug move and you have somebody check and you notice you're kind of still coning or tenting, you can then sit up and put your back against the wall and do like the arm component and just do it from that way. And that's still going to allow you to get involvement and engaging and working on your core and your pelvic floor, which is really important through your pregnancy.
Absolutely. So there are a bunch of alternatives, and Dr. Madeline has all kinds of videos. So if you do notice that this is happening to you during a certain type of exercise or movement, just like she said, message us, let us know, and we can help provide you with an alternative this time to help you get the desired results and the intention that you have behind that movement.
And I want to tell you all too, if you're pregnant and you're going through this, let's talk about real quick how to get out of bed, because how does almost everyone get out of bed in the morning? Most people do a sit-up, to sit up, to sweep their legs to get out of bed. When you're pregnant, even newly pregnant in your first trimester, you might feel like this feels weird, or it feels different, or I did it and now I have this weird pain in my low back and it's never affected me that way before. One, give yourself grace. Your body's changing so fast. Even I know it. Well, I'm going to take from Johanna's experience because I haven't been pregnant, but I'm guessing it's kind of weird when, like, you know you're pregnant, but your body hasn't really started to like change where you physically can see things.
Sure.
So when you do your normal behaviors and then you get these weird things pop up, it's probably really like a disassociation for you. But it's still because you have relaxing going on. You have all these things and hormones changing in your body to grow and prep this baby.
Sure.
So even something as simple as I used to be able to sit up out of bed early in your pregnancy could be like, whoa, this is weird or different or cause me pain. So what do we tell moms to do to get out of bed?
Roll to your side. Seriously, doesn't matter what side, just roll to a side, and then use your hands to push up, and then come into that seated position. And then again, if you need to, use your hands to push your tush off the bed and get to a full standing position. So that's getting out of bed, that's getting off the floor, depending on if you're ever on the ground, like different exercises like that. That's getting off the chiropractic table too. We should be doing the same thing, because that is one time I do notice a lot of coning that I'll see right away in pregnant patients is they just go to sit up to get off the table, and it's like, whew.
Or, no offense, y'all, are like turtles on your back trying to get up later in your pregnancy. We're like, work smarter, not harder. So here's how to do that.
This is important because, like Dr. Mallon said, your body's changing, but also you're going to save your core and your pelvic floor when you do that exercises, which are very important structures to get that baby out and to recoup and repair postpartum. So just give your body the best healing and fighting chance that it has by doing these types of movements.
Absolutely.
All right, so I think that wraps it up, right?
If you have any questions, let us know. So we got this question a lot lately. So if we didn't quite answer it for you, let us know so we can get you that information. But we'll see you next week.
Have an awesome day.
Bye.